A hearty good afternoon and welcome to a session on hand, foot, and mouth disease. We're glad to have Dr. Bhanu Varun Kumar among us today to help us explore the topic. A common childhood virus causing sores in the mouth and a rash in the hand and feet, and the condition is spread by direct contact with saliva or mucus. So the doctor is going to help us understand more about hand, foot, and mouth disease today. So don't hesitate to ask any questions if you have. Doctor, you have the stage.
Yeah. Good afternoon, all. I'm Dr. Bhanu Kumar, neonatologist and pediatrician from Apollo Cradle, Jubilee Hills, Hyderabad. So today our topic is hand, foot, and mouth disease. This is most commonly seen in uh, in this type of climate, early monsoon, end of the summer, and is mostly seen. And this hand, foot, and mouth disease usually it is or due to water contamination or orophycal contamination, and usually it is seen in below 5 years of age group children. That is the children who are going to preschools, nursery, school, till first class, like that. And in recent times in the country also, hand, foot, and mouth disease is more prevalently seen in our all OPDs and all. So this is sometimes this these are usually very commonly seen self-limiting disease. Sometimes it may even have severe complications even seen. So this hand, foot, and mouth disease is caused due to two viruses. One is enterovirus 71, and one is enterovirus 71, and one is Coxsackie virus 16. This is the milder version. Usually, symptoms are seen within first 3 days to 5 days, and they come down after 1 week. So, number one, these symptoms can be divided as two headings. One is oral ulcerations and oral signs, and another is rashes over the body. So, oral ulcerations and all usually is mild blisters and or rashes may be seen near from the jaw of the mouth to upper pharynx and upper pharynx usually. And these ulcerations may spread even the whole buccal cavity. That there is a point where child suffers more, has pain more, and cannot be able to eat food more. Due to that, dehydration is seen in the child. So number two is blisters and skin lesions. Skin lesions can be divided like it is started as a small blister forms which are seen from ankle to the palms, and from legs to the soles. And these rashes may spread in some kids. These rashes are spread very contagiously and spreads all over the body, and we have seen some cases like that. Some are very mild, which only few blisters come, 5 to 6 like that, and they disappear. Um, then regarding these rashes, it is and mode of transmission is usually nasal, throat, saliva, fluid blisters, and fecal-oral. Usually, contagious part is first 1 week of time, and other clinical features which are seen are like fever, malaise, dullness, dehydration, uh, severe dehydration, not able to swallow anything, and excessive cry due to those blisters and all are more commonly seen. Headache, abdominal pain, loose stools are also commonly seen. Other complications which are associated with this. The severe complications of this hand, foot, mouth are CNS manifestations like like seizures, encephalopathy, fatigue. These are the most common CNS manifestations which are seen. So the only usually this may not require too much of admissions, hospital admissions and all. But sometimes some cases do go to, for admission. So when it is advised to go to show a doctor, when there is no oral feeds at all, if the baby is toxic looking, fever is not subsiding from last 48 to 72 hours, continuous fever with chills, and any CNS involvement, then only it is required. Otherwise, not required. Treatment, the main thing is keep giving the baby or the child rest, hydrate the baby, and usually due to we do it symptomatically. If rashes are more and itching is there, we give anti-allergy medications, uh, antihistamines, anti-allergy medications, and for soothing of the skin, we give lotion, calamine lotion, and for oral cavity ulcers and all, we give Zyte ointment. And some kids even required lidoderm ointment and spray. That is local anesthesia, just like a spray sedation, so that burning sensation doesn't spread to the oral cavity and baby drink. Too much, we need to hydrate the child. The main thing is hydrate the child, control the fever, and give appropriate medication. So these are the things. So over, and if any doubts or any questions which is related to this can be asked. end it.
If you're done, you can.
So, if there are no questions, we will end the session. The only thing in this monsoon season, be careful. The main thing how to prevent this disease is proper washing of hands with the to the child, explaining him the importance and make the child wash hands properly. That should be enough to prevent. Thank you. Should I leave?